Some landmark achievements recorded in the health sector in 2018 are the revitalization of 109 primary healthcare facilities across the country, provision of free treatment for people with tuberculosis, HIV, and the relaunch of family planning programs to improve maternal health, the successful implementation of routine immunization across the country, provision of some radiotherapy machines to improve cancer care, and the launch of Tobacco Act and campaign were other gains recorded in 2018.
We are doing so much. In fact, the whole essence of what we've done in the last almost 3 years is on putting life into the primary care system. And that's what led us to the agenda to revitalize 10,000 PACs. So far, we've done with our partners over 4,000 of the PACs, and we'll still do more. In fact, with the implementation of the Basic Care Provision Fund, with 55.1 billion naira set aside in the 2018 appropriation, all our PACs will have a new lease of life.
Just last week, President Muhammadu Buhari, through the chairman of the National Economic Council, the Vice President, Professor Yemi Osinbajo, launched the Human Capital Development Program with the theme Healthy, Educated, and Productive Nigerians for a Globally Competitive Nation Vision by 2030. This is what our great party, All Progressives Congress, stands for.
However, the outbreak of vaccine-preventable diseases such as cholera, meningitis, yellow fever, with huge casualties and what seems like an unending industrial disharmony, overshadowed some of these achievements. Experts have blamed this on lack of managerial competence by those at the helm of affairs and called for holistic reforms that will deliver many healthcare benefits to Nigerians.
Gross infrastructural breakdown, and which of course also render healthcare professional handicap in doing what they ought to do. So it was a really big challenge. And if you want to look at the medical export from Nigeria within the year, it was so high, people trying to seek medical help abroad, when the confidence for what we have in Nigeria has failed. Definitely, if you have the money, you want to be alive, you have to seek help, external help. So that wasn't really too good also. If you look at the money that left this country towards medical intervention abroad, that's really huge. We should be looking at backward integration. The Nigerian healthcare professionals should have structures they can actually. People want to work, but there are no structures. Infrastructural decay is on the high side. Fix the healthcare sector. Bring money in. Let's restructure the buildings, the medical equipment. What we have, they are so obsolete. And not just that, let's also develop great maintenance culture. We should also have a place where we can train biomedical engineers and make them stay so that they can also fix the healthcare. Some of the issues we have is that we have no enough biomedical engineers. So when the healthcare machinery or infrastructure break down equipment, there's nobody to fix them. We should be able to actually train those people in this country. If it means developing a program or designing a program that can run for about 3, 4, 5 years and focus on having strong biomedical engineers in Nigeria so that they can actually fix our equipment when they break down, let's have that. And so because of that, we have also has CT scan today or has MRI tomorrow, and you find that in about 2-3 months you go there, they're broken down and they cannot be fixed. So these are the main issues. Then again, we can also see how the healthcare sector cannot function properly without stable electricity. If it means dedicating turbines to healthcare sectors that can be shared among healthcare sectors within each locality, that will go a long way. So that there can be steady power supply for them to do what they have to do. Imagine when you go to Italy to do an intervention surgery, you're on that surgery, halfway the light goes off. Imagine the risk. So these are key issues we must look at. Then above all, we must also create the right kind of leadership for Nigerian healthcare system. Without the leadership that we need, we can go nowhere. I'm not saying what we're having is totally bad, but I believe when we have public health physicians, right, we'll have health economists, public health actors coming to lead healthcare sector. Healthcare sector leadership talks about management of health funds. It's not talking about clinical practice but most time we'll have core clinicians that should be busy driving clinical part of medicine. You now see them that the one that are at the helm of affairs. It's a big problem. But let's bring people who are well tutored, trained in the area of health economics that know how to allocate funds to each part of healthcare, that will do us a whole lot of good.
People are dying. Look at malaria. In fact, when I published my work on malaria in 2013, I was thinking that by now we would have advanced, but regrettably we are retrogressing. The way forward is for us to be true to ourselves. If both the leader and the led are true, things will work well. But Nigeria remains a big jungle where the survival of the fittest, but negatively, becomes the order. We don't have a system that works. There's no continuity in anything we are doing. So we are just praying and hoping that manna will fall from heaven.
The issue of drug abuse became more worrisome in 2018 due to unrestricted access to drug and many unregistered pharmaceutical outlets.
We recommended, and fortunately the National Assembly has approved of this, that Nigeria needs satellite pharmacies. Now these satellite pharmacies will be run by only registered pharmacies. The prospects of the satellite pharmacy is such that we might generate about over 250,000 or more of these structures nationwide. And the idea is to give the Nigerian people or consumers of health a platform to source genuine medicines, more pharmacy facilities where you can vouch for the tenets of good pharmacy practice in Nigeria. I am aware that bill has been approved by the National Assembly and is awaiting presidential assent in the last 5 months. I want to plead, as part of challenges that President Buhari needs to deal with very early in 2019, that bill be assented to in the ultimate public interest.
The 315 billion naira health expenditure in the 2019 budget and the Lagos State Health Insurance Scheme are progressive steps that experts advised should be consolidated upon to advance the sector.